is joining. Let me take a look and see if I can do a gallery view. Oh, here we go.
Under participants.
All right. Oh, there we go. 22. Excellent. Welcome, everyone. So we have a couple more minutes before we get started at 5:15. All of our panelists are ready and to go. And so just enjoy a few minutes of some music here that we have for you all as we celebrate Hispanic Heritage Month. So while we wait. And since we have a few more minutes, we'll just go ahead and say that the National Hispanic Pharmacists Association came about thanks to corporate companies who came to Dr. Rios at the National Hispanic Medical Association and the National Hispanic Health Foundation to help start the National Hispanic Pharmacists Association. So special thank you to you all. And let's see here, what else is going on here. And then let's see here, I'm getting a request for the link. Okay.
Maria, would you like me to play the music?
Yes, please, that'd be great.
Vince, can you put the screen on, the whole screen, the one slide?
Thank you, Vince, for that very warm welcome to everyone. We couldn't do this live, so we thought we could do something special for you all at the very beginning. So good, buenas tardes, buenas noches, depending on where you're joining us from. My name's Dr. Maria Hearns Rivas. I'm the president of the National Hispanic Pharmacists Association. Thank you all for joining us today to celebrate our National Hispanic Pharmacist Association Hispanic Heritage Month. Today we will have a group of a group of panelists who are thriving in their fields to talk to you more about how pharmacists are caring for Hispanic communities, past, present, and future. And so just a few housekeeping items. Please mute yourself with your microphones. If you have any questions, please go ahead and add them to the chat box. At the very end of this session, we will save 10 to 15 minutes so that we can go through your questions and ask them to our panelist members. And then so we're going to do that brief Q&A session. Next slide, please. So what is our vision and mission? Our mission is to empower Hispanic pharmacists and other members to improve the health of Hispanic populations in collaboration with public and private sector partners. Our vision is to be the lead pharmacy organization to improve the health of Hispanic populations in the United States. With this being said, we're actively looking for collaborators. We're looking for collaborations. We're also looking for sponsors at all levels. Next slide, please. Great. So I'd like to give a very special thank you to all of our NHPA Board of Directors. They're all here listed above. I also want to acknowledge our amazing National Hispanic Health Foundation staff, without whom today would not be possible. So big heartfelt thank you to all you. And next slide, please. So a few things that we are currently working on, I'll make them very brief, more details in our newsletter. So we're currently looking for a spokesperson to join NHHF Stop Vaping campaign if you're currently located in LA, Chicago, New York, or Miami. Next slide, please. And then also the Pharmacy Technician Certification Board Committee is currently looking for pharmacy technicians or community pharmacists to help develop policy and also committee participation. So more details in our newsletter, and please volunteer, as I'm a strong believer that if you want to advance in your career, go up the corporate ladder, what have you, volunteer is a big part of that. Go ahead, please. And also, we're making a call for mentors. We highly need mentors for our pharmacy students, pre-pharmacy students. So this is a great opportunity to pay it forward. We need to train and nurture our next generation of pharmacists. So everyone, you're welcome to join. Thank you. And next slide, please. And I just want to give some recognition here to our NHPA student chapters. They're very active despite COVID. I'm very excited for every single one of them, and I'm very proud of every single one of them. Next slide, please. And our corporate advisory committee, CVS, NHHF, Pharma, and our silver corporate member, Walmart. Next slide, please. All right, so September 30th, save the date. This is open to everyone, not just NHPA student members. We have our first student webinar, Making the Most Out of Pharmacy School, September 30th, 7 to 8 Eastern Standard Time. Everyone is welcome, so please save the date. Next slide, please. And so first off, to kick off the Hispanic Heritage Month celebration with NHPA is today, September 24th, West and Southwest regions. On October 8th, same time, Southeast, Midwest, and Northeast regions. So please join us then as well. Next slide, please. All right, so make sure that you stay connected with us. We are on social media, myself as well. And if you have any questions, you need to call us, or if you'd like to make a donation, please follow the links. Next slide. And let's go ahead and get started with our panel members. All right. So thank you to every single one of you panel members, and thank you for agreeing to volunteer your time today. It's very important, and it's also very special that we're all here together. So I'm going to go through a list of questions, and I've already pre-selected who would be answering each of these questions. For those participants who are here joining us and listening to this conversation, if you want to ask a specific question to any one of our panel members, go ahead and add it on the chat box, and we'll go ahead and make sure that we add it at the Q&A session. So to start off, this is actually going to be a question for all of our panel members. It's going to be, what was your pathway to pharmacy, and what is your current role now? And we can, we'll start off with Dr. Jimenez.
Good afternoon. My pathway to pharmacy started when I was a senior in high school. I had a third-year pharmacy student from USC come and talk to us about career day and what we were going to do after we graduate. And so pharmacy wasn't in my orbit, and I thought about it, and I said, interesting, let me look at what the requirements are, and that was my pathway. I'm probably the most senior panelist here with over 40 years of experience as a pharmacist. So thank you for allowing me to go first based on age. And my current position right now is Director of Diversity Initiatives at Western University College of Pharmacy. And my role is to inspire young Hispanic students or underserved minorities, not only Hispanic, but Blacks also. And at Western University, Caucasians are considered a minority. So trying to inspire them to consider pharmacy as a career option. So that is currently my role now.
Wonderful.
Thank you.
Thank you, Dr. Jimenez. And I'll hand it over to Dr. Bullock.
My father was actually the owner of an independent pharmacy growing up. In high school and college, I helped him prepare some continuing education programs and really gained an appreciation of pharmacy. I graduated with a biology degree from Texas Tech University and eventually decided to pursue a career in pharmacy and graduated from the University of Texas College of Pharmacy. I'm currently the PIC of United Medical Center, which is a 340B federally qualified healthcare facility in Del Rio, Texas, which is a city on the border with Mexico. And we do serve a predominantly Hispanic community.
Wonderful. Thank you. And I'll hand it over to Dr. Galindo.
So I guess before pharmacy school, I was a technician for about 6 years in retail, then attended pharmacy school in San Antonio at the University of the Incarnate Word. I've been with Kroger for about 4 years now and have been PIC for 3.
Great, thank you. And then Dr. Gonzalez.
Hi, everybody. Adrian Gonzalez. I guess my path to pharmacy started in high school as well. I was either going to be an architect or a physician. My high school counselor told me about pharmacy as a way to get into medical school. While in pharmacy school, I loved it. Did my residency, and that kind of solidified things. And you know, today I am the system pharmacy director here at Adventist Health. We're a multi-state, multi-hospital healthcare organization and covering hospitals in California, Oregon, Washington, and Hawaii. And we have hospitals in the Central Valley, East Los Angeles. And our mission is about caring for those that are underserved here at Adventist Health.
Wonderful. Thank you, everyone. I believe some of our panelists may be running a little behind. So I'll go ahead and improvise and we'll keep on moving forward. Once they jump in, then I'll make sure that I ask them the questions that I had previously assigned. So we'll go ahead and get started. First question for Dr. Bullock. As we come together to celebrate Hispanic Heritage Month, what does providing excellent care to our Hispanic patients means to you?
I believe it means, first of all, really respecting the Hispanic culture and understanding their family dynamics. I'm actually not 100% fluent in Spanish, and I occasionally do need translation services, help from my technicians, but I believe it does go a long way when I'm able to initially address and begin counseling and communication with my patients in Spanish. And so even sometimes I can, get through the whole thing, but if there's ever questions or I'm not fully understanding, I do always ask for translation services. I think that is extremely important. But I believe first and foremost, it's about gaining trust and showing understanding of family and culture of the Hispanic people. Secondly, I think providing, excellent care to Hispanic patients is really being exceptional at and really caring about counseling on diabetes and hypertension and just being exceptional at those. And thirdly, just understanding Spanish cuisine and the nutritional aspects of their diet to really better affect health outcomes in that population.
Wonderful. I could not have said it better myself, Dr. Bullock. That's an excellent explanation. Thank you so much. And then next up here, we'll go ahead and go over to Jenny, Dr. Galindo, I'm sorry. So for Dr. Galindo, what are some of the future barriers that the Hispanic community is likely to face?
I feel like a lot of the future barriers are the same as some of the past and present barriers. One being language. That can lead to lack of education of their disease states, of their medications, of their treatment, lack of understanding the importance of adherence. So I believe language will continue to be a future barrier. Also, another barrier would be financial. There's a big population that still doesn't have insurance. I know in retail, a lot of our clinical cases are identified by insurance plans where they identify patients that are non-adherent or need their refill. And so if they don't have insurance, those are a big portion of the community that aren't being identified. And I guess their adherence is not being improved. I think also the mindset, there's a certain mindset that a lot of Hispanics have, where they feel like they only need to take their medications when they feel bad, that their health is just in God's hands. And there's just also like a mistrust in healthcare providers that can't communicate with them.
Thank you, Dr. Galindo. I will second everything that you've just said. Definitely see it every day with my own patients. And then also for Dr. Gonzalez, same question. So what are some of the future barriers that the Hispanic community is likely to face?
Yeah, no, good question. Thank you, Maria, for including me on this one. You know, part of my background, you know, I grew up in the fields and agriculture here in Central Valley. And I think one of the barriers that, you know, that I think is going to continue is access of care. And how do we bring healthcare to our patients? The use of technology. You know, culturally, you know, I think the first question you asked about, you know, what does treating Hispanic patients mean to me? I was like, well, being a Hispanic patient, growing up in the farm towns of, you know, of Bakersfield and whatnot, it's all about, you know, bringing access of care to these patients. And so one of the innovative ways that we've done with Adventist Health and just what pharmacy's been doing is using technology and telemedicine to bring pharmacists to these communities, bringing mobile clinics to the fields and to be, you know, go to the patients. A lot of times it's incorporating, you know, the family and the well-being of the dad or of the mother. You know, I was actually doing a counseling session with a patient, you know, a few years ago, and I couldn't get them on the diet. And he told me, he's like, well, I eat, you know, in Spanish, you know, I eat what my wife makes me. And I was like, there's the barrier. I got to talk to your wife. I was like, bring your esposa, you know, next time to the clinic. And then I told her, it's like, he's like, oh, okay. And then from there on out, he was like, yeah, I just eat whatever she gives me. So if she feeds me, you know, different things, I'll eat that. And it's like, so the barrier is, you know, access and making sure that we eliminate some of these, not only geographic barriers, but then I think that technology where today we're able to dial in to the family members now to incorporate them in the clinic visit. But I think making sure that our Hispanic populations, our rural healthcare clinics has access to the new technology that maybe some of our bigger cities have.
Yeah, that's a very, very insightful kind of into the world of pharmacy and healthcare and the barriers. And I hope that for all of our student members and members out there listening, you know, jot down some notes because you're going to get some really good suggestions and ideas from here. So thank you, Dr. Gonzalez. Next question is going to be for Dr. Jimenez and Dr. Perez. The question is, how is your institution working towards eliminating healthcare disparities among our Hispanic patients? And what adjustments are currently being made during this COVID-19 pandemic?
Well, at University of Western College of Pharmacy, pre-COVID, we were very active in providing health fairs, not only within the community, but outside the community. And what we done recently was, because Pomona is 75% Hispanic, but I started reaching out to the Catholic churches, which is predominantly 90% Spanish speaking throughout all their masses. And so we were able to get permission from the Monsignor at the local parish, and we started doing health fairs there. And one of the big things that we are fortunate at Western University is that we have 9 health sciences on our campus, which is pretty extensive, with the medical school in optometry, podiatry, dentistry, and veterinarian, physical therapy, and physician assistant. So yearly at the Pomona Fair, we collaborate with the other health sciences, and we offer a big health fair for everybody in attendance. And that is usually a great turnout. Unfortunately, with COVID, everything is on hold. The university feels that there's a big liability issue with the students and not being susceptible, that to COVID-19. So understandably, hopefully in the spring that we can resolve this issue and get back to providing health fairs. We also have different organizations in the university that extends themselves beyond just doing health fairs. We have people that are involved within the community from the university. So that's a great outreach project that our university is able to do. We also work with the homeless and providing health care, but not only that, we feed the homeless and we clothe them. So that's a big introduction to some of these pharmacy students that never been exposed to interacting with the homeless. So it's a great education process for them to let them know that, hey, this really exists. You might come from a upper tier family background that, you know, just turns and looks the other way to a homeless, but being exposed face to face is a reality check. So I'm very happy to be able to provide that service with them.
Thank you, Dr. Jimenez. Yeah, with the COVID-19, it has definitely impacted everyone. Who has it not impacted? And definitely a lot of modifications being made. For Dr. Cynthia Perez, same question for you, and I'll go ahead and repeat it. How is your institution working towards eliminating healthcare disparities among our Hispanic patients? And what adjustments are currently being made during this COVID-19 pandemic?
Sure. Thank you so much for being on, and I apologize for being late. So excited to be here. I come from the world of retail in El Paso, Texas. So I work right on the border of New Mexico, Texas, and Mexico. And in terms of our company, we really try to be all inclusive. We do have certificates for our technicians and our pharmacists to get certified to speak Spanish. We also are able to allow them to get Rosetta Stone for free so that they're able to learn the language of Spanish, since that is a predominant language here in my area. As a company, we do quarterly healthcare fairs where we do blood glucose, blood cholesterol, BMI, and blood pressure screenings for free to the public as well. And so from a company perspective, we really try to include all of our communities within Walmart to come in and get free health screenings. From my perspective as a pharmacist, I do a lot of community outreach. I work with a lot of the pharmacy technician programs to get the high school students involved. And we have our own health fairs out in the communities with, for example, the Diabetes Association, some of the local organizations, to bring that information to our communities in terms of adherence, medication adherence, any questions they might have around their medications. In times of COVID, we also have expanded our services, so we are able to mail out prescriptions, deliver them as well. We're able to offer that service free to our community so that if they are not able to come into the pharmacy to pick up their prescriptions, we're able to take them out to them. And so what I do on a daily basis is I call my patients that are, you know, on maintenance medications, diabetes medications, blood pressure medications, and I call them ahead of time and I ask them if they would like that service so that we can actually still take care of their medications and keep them adherent on their medications. And it's a free service to them here locally. So in addition, in terms of COVID, because we're a retailer, we also provide drive-through COVID tests. And so when those patients sign up for that COVID test, they can come through our drive-through and have that easily accessible to them as well. So we've done a lot of modifications around how we can take care of our patients from a perspective of, you know, mail outs, door delivery, or anything that they might need. We try to cater to them as much as we can.
Great. Thank you, Dr. Perez. Thank you for that very insightful information. One of the beautiful things about being a pharmacist is how we are directly connected to the community and all of the health fairs, you know, that are going on and outreaching to high school students. So thank you for all of your work, Dr. Perez, and thank you for sharing it with us today. And I'm going to come back to question number 2. that I had for our panelists. And this question is for Dr. Furkowski. So Dr. Furkowski, if you could tell us, as we come together to celebrate Hispanic Heritage Month, what does providing excellent care to our Hispanic patients, what does that mean to you?
I take a lot of pride in the work I do in the community. Our patient population, I'm the director of pharmacy for the UCSD Student Run Free Clinic projects. I oversee 3 pharmacies in the community. We have a large underserved patient population, about 95% of them being Hispanic and undocumented. So, having grown in a low-income family myself and having access as a child, along with my mother and my brothers, low-income health services in the community, I kind of knew firsthand like what it felt to stand in line, waiting for someone for care, what it felt like being without insurance. And even my mother at the time was undocumented, so even having the fear of having her deported. So I grew up with all those things in my mind, and I realized I needed to do something to do to help my family and also help the community I grew up in. And so when I was presented with the opportunity to become the director of pharmacy, I realized I already knew what I needed to do, and it was a matter of just understanding where patients were coming from, understanding what their struggles were, becoming friends with them, gaining their trust, understanding also that life is really hard, especially right now. A lot of our patients are out of jobs and they're struggling to pay their rent. They're struggling to pay for food. But one thing they are not struggling with is to get free medications. And so that's what it means to me. It's like, even though we can't address all their needs, whether it be personal, whether it be financial, but at least, we have created a safety net for them that they can rely on, that, for those patients who are diabetics, who have CHF, who have MI or depression, that they continue to get their meds. And not only along with their medications, they get food, free food. And so, I think coming together as a whole, we can really be impactful. It might not be, like I mentioned, in all aspects of life, but at least we can address like the more dire needs that people have, and that's to keep our community healthy. And that's ultimately, I think, what it means to, for Hispanic Heritage Month, that, that we are all here, are striving to make our community more healthier, so that people can live longer, and they don't have to suffer the whether it be side effects or the lack of medication or so, that we're there, and we're constantly on the phone, calling them, talking to them, especially our high risk patients. And so knowing that they have people to rely on, to fall back on, I think that's what ultimately, that's what that all means to me.
Thank you, Dr. Verkopsky, for your thoughts and your insight. I want to take a moment to say how much mentorship, its value. Dr. Verkopsky was actually my mentor when I was at UCSD. I was there volunteering at the UCSD Student Run Free Clinic. I love that clinic. I'm not in San Diego, I'm in Northern California, but mentorship is very, very valuable. So I'm gonna take this moment to make a call for all of our pharmacists. You don't have to be from the same ethnic background as the students or vice versa, but I would like to take this moment to make a call for mentors for our students. We need to generate that next generation of pharmacists, not just caring, for the field of pharmacy, but also how are we going to help our underrepresented and minority groups? How are we going to help them thrive? Because the minority is now the majority. And so we need to train that next generation of pharmacists. So thank you, Dr. Verkopsky, for your insight, and thank you for your mentorship. And so I'll say that. Moving on to the next question. So here I'd like to come back to all right, so this question is going to be for Dr. Bullock and Dr. Galindo. The question, we'll start off with Dr. Bullock. The question is, what are some of your recommendations to improve healthcare for our Hispanic communities?
to repeat and just reemphasize several points made by other panelists, especially Dr. Gonzalez, Dr. Frykowski. Y'all both hit on some of these points. First of all, I think really providing access to care is important. Some of the greatest successes that I have seen or been a part of was with a volunteer healthcare clinic where patients were able to come and be seen by providers and in the same visit receive free medication and do so within an evening. And it was based completely on volunteer providers providing those services. And it was a great service. It really worked well and really helped those underserved populations. I also currently love my job because I work at a federally qualified healthcare clinic that our mission is to once again provide care to underserved populations. I offer affordable, not free, but affordable medications to the population. And they are able, once again, to come into the same clinic, the same location, be seen by providers, then step to the other side of the building and receive their medications, you know, perhaps in the same visit, but they're familiar with it, it is accessible, and it's affordable. So really providing access to care, I think, is important in improving healthcare outcomes for Hispanics. And secondly, going back to diabetic, hypertension, and nutritional counseling care, one of the things that I think is so important is always providing hope in newly diagnosed diabetics. It can be a shock in getting that diagnosis. And so, you know, counseling them, empowering them, educating them, letting them know it's not the end of the world. And then also providing hope and providing a glucometer. I know that's been hit on as well, but emphasizing their taking that ownership of that disease with giving a free glucometer. And we do offer a free glucometer, and those kinds of services are really important. I think emphasizing baby steps, you know, like I said, it can be quite overwhelming to get that diagnosis. So, and even throughout their care, baby steps of cutting down, practicing moderation. It doesn't have to be all or nothing. A lot of times all or nothing leads to defeat and complete non-compliance. So encouraging them, letting them know that, you know, baby steps and making some improvement helps. And, you know, I think you can eventually get to the goal that where you're going if you can encourage just baby steps along the way. For example, instead of, you know, eating 12 tacos, let's reduce it to 6, and then maybe they can, you know, reduce it to 2 after that. But letting them know what the nutritional aspects are that really might be affecting their disease state. Just making sure they pace themselves, letting them know it's a marathon and not a sprint. And encouraging them at all times to always rely on you as a pharmacist for support and as a resource going forward if they have any questions about their disease.
Thank you, Dr. Bullock. I'm actually we're doing really great on time. I'm very proud of that. So what I'm going to do, I'm going to go ahead and come back to some of the topics that the panelists have answered, since it's still kind of fresh in our mind. So Dr. Bullock, I have a couple of questions here for you. So one of the questions here says, Dr. Bullock, you mentioned understanding the Hispanic cuisine. My college runs a student-run clinic that serves the underserved community, and most patients that we see are Hispanic. How would you approach a patient in terms of changing their diet when you know they love their tamales, salsa, salt? I think you already started to talk about this, so if you'd like to add anything else.
Sure. You know, let's say you have a breakfast taco. It's about those little things of perhaps, you know, opening the taco and, you know, pulling off maybe part of the portion that overlaps. You know, it's those little things of saying, you know, doing that does make a difference. And so letting him know that small changes like that, and, you know, just moderation and trying to cut back. You know, I know making tamales is a great part of the culture, but maybe we do that 2 times a year instead of 4 times a year. You know, it's important to enjoy life and keep enjoying your, you know, what is great about life, but just encourage moderation. It's making those little changes understanding, what choices might be better than another one. And then when you do, want to achieve, even, with diet or trying to lose weight, try to do that in moderation. And when you do eat it, don't feel guilty and go on. You might talk about, changing their insulin doses during those times. Kind of depends on the situation, but just encourage that it doesn't have to be all or nothing, that small changes or, cutting that little bit of the taco off helps a lot. And so just encouraging them to make what little changes they can, and letting them know that it does make a difference.
Okay, and then so I'm going to continue to go down the questions. Bear with me, it looks like more questions are coming in, so it keeps changing a little. So here, next one is, so we have that one. Dr. Bullock, Lalimar Havern, she lives in Del Rio, and she would love to connect, so I'm sure she'll be looking for you in LinkedIn.
She can find me at United Medical Center on Main Street. Please come by.
Oh, there we go. Personal invitation. And let's see here. Okay, we'll come back to this one. There's another question, and it keeps jumping around a little. So the next question, I believe, is for Dr. Perez. Let's see here. I'll come back to the one that's for the general for all panelists. So let's see here. That's for all panelists. Dr. Perez. Oh, just one second. So this is Ms. Bueno, and this is for, I think it's for Dr. Perez. She says here, I know Dr. Perez is addressing this issue, but how have the means of patient outreach changed during the beginning of the pandemic? And what adaptations has your institution implemented in order to combat this? If Dr. Perez would like to add anything else?
Sure, I would love to. I think a lot of it is proactively looking at your patients. So at Walmart, I'm a retail pharmacist. I'm actually able to look at patients and see how adherent or not adherent they are. We do a lot of MTMs in the retail space with regards to adherence, and that means like metformin, your diabetes medications, cholesterol medications, and hypertensive medications. And so I proactively will pull reports myself, and I will reach out to that population. And I know that that's something that we do company-wide. And so that became more of an aggressive approach because we knew that people were possibly going to be limited with regards to coming into the store or calling us, asking us questions. So I proactively call the patients and ask them how they're doing. Ask them if there's any gaps, if they're taking their medication as prescribed. Here locally, we see a lot of patients that will split doses or they will share medications with family members. And so I try to reach out to them and understand why they're being non-adherent, what I can do on my end to support them. And so with regards to that, if they can't come into the store, that's where we try to, or at least I try to mail out their medications or personally deliver them to them. And then over the phone, I'll consult them or I'll counsel them on any barriers to their medication adherence. So we really try to proactively look through our reports and try to contact those patients proactively. Any patients that we have that are very they're regular patients, we try to reach out to them as well, especially if we haven't seen them in a while. I know we've had patients that have lost spouses to COVID. And so we try to check in on them as well. And I know that this is locally, a lot of our pharmacists are doing that so that we can take care of them on that end. So it might be a telephonic conversation or a counseling that we do over the phone as opposed to face-to-face interactions. Or we ask them, do you want us to deliver this to your house? And then we have a conversation, 6 feet apart. We review whatever it is that we're delivering for them. And so we really try to be more proactive as opposed to reactive when the patient's already in the store. So we try to get them to be adherent, call them, understand what gaps they have or what barriers they have on the front end, and then do any counseling or understanding why they aren't getting their medications. I'm also lucky that in our company, we have a $4 and a $10 medication list. And so sometimes if medications are too expensive for the patient or they let us know that they can't afford it, that's where the conversation starts. And we start talking about, do you want us to talk to your doctor? and be that bridge to see if there's something that we can change, some more affordable alternative. And so that's how we've kind of modified during the times of COVID to reach out. So we're doing reaching out to patients as opposed to waiting for them to call us or come by the pharmacy.
Great. Thank you, Dr. Bettis, for that insightful information. And thank you for all of your hard work. I know that right now during COVID times, it's just everyone's just working on overdrive right now sometimes. And this question is, I believe it's for Dr. Frykowski. This is from Ms. Chavez. Her question is, what partnerships has Dr. Eduardo Frykowski formed that allowed him to provide medications at no cost to patients? How are his programs funded?
I always get that question because so we formed several partnerships. One is with the medical center. The UC San Diego Medical Center provides our medications. We order all of our medications through the medical center, and they pay for a portion of the medications. At least they cover all of our insulins, which is very significant, around $20K a year. We also get medications for free through Amerisource and also Direct Relief. We get free meds. And we also have a fund run. So the student pharmacists, as well as undergraduate volunteers, and including students from the medical school, we do a 5K fund run, and we raise around $12,000 every year. The rest of it comes through grants. They're either local, state, or federal grants that help to pay for the medication. And about 20% of all of our medications come through patient assistance program. So pharmaceutical companies have set up a patient assistance program that offers free brand name drugs to patients who are low income. And they have, a lot of different requirements, but we've been able to get around a lot of those stuff and manage to really be able to access free medication through this program. We get all of our injectables, insulins. We get very expensive medications through them. Sometimes all of our inhalers. We couldn't really do a great job with our care if it wasn't for these medications, because they're a very important arsenal in terms of our med formulary. And there's just certain classes of meds that we just don't carry and we can't purchase because they're so expensive. Our flu vaccines we get through the county. We get about 300 flu shots every year. We also utilize the patient assistance program for all our Pneumovax, Prevnar, Chinrix, and Tdap as well. So let's see, those are just, I think, all the programs that we access. Every so often, we got $100,000 worth of glargine, and from a program called TCOID, Taking Care of Your Diabetes. So they called us up and said that there was a family who donated money and they wanted to spend it on insulin. And they said whether we wanted the insulin. I said, of course. So I said, we were so glad because now we have almost like 6 months worth of insulin in stock. So, yeah.
Great, Dr. Frykowski. Thank you for that information. And Ms. Chavez says, thank you very much for sharing. So thank you. I'm going to save the questions that are general for all panelists at the very end. We'll keep moving forward. If I catch something that's something for a specific panelist, I'll go ahead and pause and shift a little. So I'm going to come back to Dr. Galindo. Dr. Galindo, if you could give us your thoughts on the following question. What are some of your recommendations to improve healthcare for our Hispanic communities?
So I second the recommendations that Dr. Bullock also mentioned, but just the need for more community involvement and education would be helpful, whether that's through organizations, through churches, through schools. I think that's key. I think there's still a need for more bilingual healthcare professionals. One thing I would also, I guess, like to recommend to employers is having a bilingual pay incentive in the workplace. And that could encourage more professionals to maybe study another language to utilize it in their workforce. And then maybe some way, maybe via an app where patients are able to locate pharmacies with Spanish-speaking pharmacists. I know in my district, I'm only one of 2 Spanish-speaking pharmacists. So I frequently have patients who are just so excited when they find me, a Spanish-speaking pharmacist, and even though they've passed maybe 10, 15 other pharmacies, to come to mine, and then they'll have me transfer the prescriptions for their whole family. Just because in my area, there's not many that can communicate with them.
Thank you for that information, Dr. Galindo. And then the next question that I have here. So this question is for Dr. Frykowski and Dr. Jimenez. We'll start off with Dr. Frykowski. What types of efforts are currently being done at your institution to help increase the numbers of Hispanic pharmacists? Because as we just heard from Dr. Galindo, they are in high demand. And so how do we help close that gap?
That's a really good question. Aside from my another hat I wear, I think I wear too many hats, and that's why I don't have a lot of hair. But but another one of my roles I have, I'm a director of the Health Careers Opportunity Program. Is a grant from HRSA, basically encouraging young, underrepresented, low-income students to pursue careers in healthcare, primarily pharmacy, medicine, dentistry, and veterinary. And so we've been very successful in recruiting undergrads to participate in this program, as well as high school students, and get them early on and encouraged to pursue careers in healthcare. You know, being the director, I'm able to more so sell them on the idea to pursue careers in pharmacy. They're able to see the work that I do, you know, my academic, the clinical, and the laboratory research. So they kind of are encouraged by what they see, and at the same time, you know, act like their mentor, their coach, and help them through the process when it comes to applying, preparing them for interviews, writing the letters of recommendations. So we have a very strong pipeline through UC San Diego, thanks to the grant. We also have another grant called the Hispanic Centers of Excellence. And so through that grant, we're able to support Hispanic fellows, which in this case, not just medical fellows, but pharmacy residents. One of the things I was explaining to Dr. Rivas was that we don't have any Hispanic residents in our UCSD medical center, which is unfortunate. So we don't have any of our pharmacy residents in that program, but we have about 14 medical fellows in the program for the HCOE. And so they get a stipend of $5,000 plus a $10,000 grant to work on research, which would be great if we could funnel more students, pharmacy students who are in residency, especially at UCSD, because this is only for the UCSD. And if we could have more Hispanic residents, that would be awesome. So I think there's still a lot of work to be done. There's still, we have some students in the pipeline that are very young, you know, in high school, so we still have to wait several years. But right now we're working on our undergraduate program. We have a program called PUMP. It's very similar to another program the medical school started called PUMA. Basically, it's we have students who are ambassadors. They work with the students directly, and they work with the undergraduate minority students primarily in helping them to apply. One thing we noticed in our application pool was that there was a lot of underrepresented minority students applying to pharmacy school, but not all of them completed their application. So out of 30 applicants that applied, only about 5 of them completed their application. So that was curious. And so we started working with that group in order to get more students actually to submit their application. So yeah, there's a lot of effort going on right now. And so I really would like to hear what other institutions are doing, and hopefully we can work together.
For our, yeah, I'm sorry. Yeah, what I was going to say is, and you probably are aware of the apothecary program at Kaiser. That exists where I go ahead and make a presentation. It's underserved minorities and that are looking at pre-pharmacy. So I try to steer them to Western, of course. And my role is going to high schools for the career day, going to junior colleges in the Inland Empire, and going to the colleges, the Cal system, and trying to bring them in and encourage them to stay in. Unfortunately, we had Latino students that weren't able to cut the mustard and failed. And it's a very difficult road, as you all know, but we try to look for students that we know that would be successful. And one of the things that we do, and that is to use the majority of our scholarships for students who have problems making tuition. They were afraid of how much the tuition is yearly and how much they'll be in debt by the time they graduate. So several times I had to speak to the parents and speak to them in Spanish and let them know that it's a great career, that there are scholarship opportunities. In fact, your organization, Maria, has a scholarship program. And so we encourage students to apply for every scholarship that's available for them to ease the burden. But it's something that I wish I can go ahead and be like Jesus Christ, who was able to bring in his 12 apostles to nurture these kids and bring them all into the profession of pharmacy. It's not very easy. A lot of times you have kids that you think have the potential, but then at the last moment they change their mind when we tell them, hey, you know, we're taking applications right now, and they say, well, I don't think that that's meant for me. So, and it's true, it's not meant for everybody, but it's a very great profession. And for those that step into it, you'll realize that you made the right decision.
Thank you, Dr. Jimenez. I'll also say that we also invite pre-pharmacy students to join NHPA. Our mentorship also includes them. So if you guys have a pre-pharmacy mentee, it might be a good opportunity for them to also get themselves integrated with NHPA. We're very small as a whole, but chiquito pero picoso, just, you know, we're very mighty. So the next question here is actually going to be for all panelists. And we can start off with Dr. Jimenez and we can go down. So what collaborations are you currently looking for and or would recommend?
Since I'm at a university, our collaborations is with the other health sciences. As I mentioned, we collaborate to do health fairs, whether it's the School of Optometry or medicine. We work together. We reach out into the community, and even though there's a segment of the university that already works within the community, we try to find niches where the health fair makes an impact. And as I mentioned, there is one group that that addresses the homeless, and I like that. I like working with that group. They're not related to the university per se. They're an extension, but always rely on us and other health sciences to provide these services. We also reach out to the undocumented. There's an area in Pomona where it's nothing but just undocumented Hispanics that sometimes they're leery of requesting our help, but through connections, I say, you know, if you need immunization, blood pressure checks, and diabetic checks, we're there. Just let us know. So I just feel that these are the segment of society that really needs our help. So we try to address those issues and to collaborate as much as we can with other schools within Western University so that we can give them a whole total workout and address their issues.
Great, thank you, Dr. Jimenez. And to you, Dr. Bullock, same question. What are some of the collaborations that you're currently looking for or would recommend?
First off, I would like to, Dr. Glendo said this really well. I think that translation services are extremely important. And I'm saying this being not 100% fluent. I'm pretty fluent, but not 100%, not to the level where sometimes I can't get across the meaning that I need. And I have 5 technicians who are fluent, and 2, actually, at the same time, I have 2 of them that I feel I'm unable to understand enough that I can understand who's getting across the meaning that I need to get across. And so I really depend on those 2 who have great healthcare literacy and language and are able to translate and really get across the meaning. So I can't emphasize enough that language barrier is very important. And I like the bilingual pay incentive. I think that is something that's necessary and really does offer better care to communities, for sure. Secondly, Dr. Jimenez focused on this a little bit. I think that having some collaboration with Catholic and other religious entities is always a good thing. You know, a lot of people go to their religious organizations, you know, they might be ill or, you know, if they are having financial burdens, you know, sometimes churches can offer benevolent services there. But even beyond that, just making sure that religious institutions know what services and things that your pharmacy or clinic can offer so that they can refer patients and feel comfortable referring patients and have the information to refer patients to accessible areas of care. And then lastly, just kind of emphasizing to collaborating just within the community, just being out there in the community, advocating for our profession, explaining what we do as far as medication safety and the importance of our position in the healthcare system, and just us as being valuable as a resource to patients.
Great. Thank you, Dr. Bullock. And then up next, Dr. Galindo. Any current collaborations that you're looking for and or would recommend?
So the only, I guess, one I'd like to add to the what's already been said is collaborating with pharmacy schools and any really medical professional schools to emphasize or put more emphasis on maybe a medical Spanish elective course. It was an elective when I was in school, and only 5 of my classmates, including me, took advantage of that. So it's provided, but maybe perhaps if they can put that in more schools and just really emphasize on the importance of it, I think that would help.
Okay. Thank you, Dr. Galindo. And then same for you, Dr. Gonzalez, if you'd like to add anything else.
Well, healthcare in general is moving towards a population health model. And so how do we make our communities healthier? And so anytime we immerse ourselves as a profession into the communities outside of our, traditional workplaces, our communities are going to get healthier. And so, partnering with churches, partnering with schools, wherever we can influence change is essential. So any collaboration with some sort of influencer within the community, I think is a plus or a win. So whether it's another, company, I know we work with the Wonderful Company, which is a big agricultural company in the Central Valley. We work with larger companies up here. And so our whole goal is, how do we get closer to the community? So I think that's kind of the big key is, who's known within the community, and go to those, other institutions outside of your traditional pharmacy models.
And then same for you, Dr. Frykowski. Any collaborations that you're looking for or would recommend?
Well, I'm always looking for collaborations to work on any project that deal working directly with the Hispanic community on health issues, on outreach. If a multi institutional grant goes a long way, and if we can find partners to work on any of those topics, and if you guys are interested in collaborating, I'm always willing to help and to be part of it. I think we need to work on I'd like to work also on getting a list, like if we are interested in pulling together a list of recent graduates who are fluent in Spanish. Right now, with the market being kind of tight in terms of jobs, it would be nice if we can all share students, because they always ask you, like, hey, do you know anyone who's fluent in Spanish? And that one student is taken already. But if there was somehow we can pull from a list or pool of recent grads who are fluent in Spanish, that'll be nice, because then we can refer students in the program as part of the organization to those jobs. And then lastly, I, been thinking more and more about this, and I really want to do something about it because it always pains me when a student says I applied for residency and I did not get in. And so I think it's something that our organization at large, as a pharmacy profession, we need to deal with this matter regarding residency. It's not fair that students who want to do a residency and don't get into residency, just because there's not enough residencies. We need to just push so that all the students who want to do a residency can do one. And I think I'm thinking residencies, more particularly working with the underserved, which I am not aware of any residency right now that's currently. There might be a few. I might be mistaken. Even with global health, for health programs and stuff like that would also be be supportive. So just to keep in mind, if you're interested and you want to work on these issues, let's get together, have a meeting.
And I'll go ahead and put in a plug real quick in terms of residency. It is a big topic, and it is a topic that we will be addressing in our student webinars. And this is for NHPA pharmacy students members only. So please stay tuned. We'll walk you through the entire process and even what to do if you don't match. So please stay tuned. And then Dr. Frykowski, yes, we need all of us, we need to collaborate on this. And I will say that it's not that it's the end all be all, but it is one way. And I'll share more with you guys at another time. And so thank you for that, Dr. Frykowski. And then Dr. Perez, same question for you. What collaborations are you looking for and or would recommend?
Sure, thank you for that. I definitely would recommend, and I'm just going to echo what's been stated before, is partnering with, your local student organizations or schools. I definitely do a lot of work with the high school pharmacy technician programs in the area, whether that means a speaking engagement or inviting them to be part of our community outreach. Locally here, I can tell you as a first generation college student, it is very difficult for students to find a path, whether that's pharmacy or healthcare career path. So really encouraging them and interacting with them, I think it has worked for us in terms of that. But I also would like to collaborate more with the local organizations. I work a lot with the diabetes organization, but even more so with more, underprivileged communities in our area or undocumented. We have the privilege, in my case, we have Walmart Foundation. And so I've been trying to connect the Walmart Foundation with a lot of local organizations because they do donate a lot of funds. It's a very simple application process. And so that's what I've been trying to work on, or what I've been wanting to do is just, whether that's a church or a local organization that works with undocumented immigrants, just to connect them to the funds that we have that we can allocate to those organizations has been one of my goals.
Great, thank you, Dr. Perez. And I want to respect everyone's time. I do want to say that it is 6:16 Pacific Standard Time. We did ask the panelists if they were willing to stay just a few more minutes to answer some of these questions for our panelists. If you need to step away for whatever reason, we completely understand, and we want to thank you. We want to respect your time. Some of the panelists did agree to stay, and so thank you for staying. So if there needs to be any transitions, go ahead. So thank you, Dr. Perez, for that, for those thoughts and for all of your hard work and all of these collaborations, and really to all of our panelists. What I want to do next is come back to the general questions that were going on for all of the panelists. And actually, before I do that, Dr. Frykowski, when you came up with the idea of coming up with a list of NHPA members who are fluent in Spanish, you got a lot of excitement going on. That's a great idea. Love this idea. Yes, that would be great. And then another one, please let me know how I can help and how to execute this. So they're ready to jump on. So great ideas from our panelists. So thank you so much for that. All right, so I'm going to take it back to the beginning just to kind of see what else in general for everyone, some of these questions. So let's see here. Just give me 1 second. Okay, so this is a question for all panelists, and anyone that would like to answer it, go ahead and jump in. This comes from Miss Kimberly. I specialize in psychiatry and sometimes run into the situation where Hispanic patients will tell me that their culture, psychiatry is not accepted. I find this interesting because they will tell me about spirits visiting after a loved one dies, and the Day of the Dead from Mexico is believed in, but they believe psychiatry is hocus pocus. Any thoughts? Any thoughts on how to counsel a patient who is just not coming on board with mental health medications?
I think in general, mental health, there's just a stigma, whether regardless of, cultural background. I do know that, in, our Latinx communities, that is something that, it is not a quote unquote disease to them. There's just something different. So our clinical pharmacy specialists, and we do have one of our inpatient psychiatry units in East Los Angeles at White Memorial. And what they've done is essentially find common ground and try to relate other disease like diabetes. Everyone knows in the Hispanic population what diabetes is because everyone unfortunately has it. And so it's treating more of the disease or the sickness rather than just the outward symptoms. And so making sure that that it is something that's real, not something to hide, but it's something to bring to the forefront. And I think bringing in the family members is definitely crucial in treating, I think, some of the Hispanic populations, not even new psychiatry, but like I mentioned with the diabetic, with diet and whatnot, a lot of times it's a family affair. We have to bring the entire family and finding that common ground, and that it is not taboo to talk about some of these other, disease states, but to really, bring light to it and to really, find common ground and just be, be loving and respectful in that manner.
Anyone else that would like to contribute? So I just want to share a few thoughts, only because I specifically see a lot of depression in my ambulatory clinical practice. And then also I work at an inpatient psychiatric hospital. And so it's a very sensitive topic. I see it all the time that my Hispanic patients, I predominantly work with a Spanish-speaking panel of all patients with diabetes. And when it comes to mental health, it's very sensitive, and it's a lot about how they feel and how others are going to perceive them. But when it comes to diabetes care, if I have a patient whom I am noticing that they are so depressed that they can't take care of their diabetes, I can't even start talking about the diabetes. First, I have to talk about the depression. I connect them with resources that we have, licensed clinical social workers, LCSWs. I love them. They're amazing. I also connect them with classes that we have, Manejando su estrés, depresión y ansiedad. So really just, connecting them. And then also part of being a healthcare professional is just being human. So I'll share with them experiences from my own family members and like the drastic difference that I'll notice in terms of when they weren't taking antidepressants to when they are. And it's just a remarkable difference. Don't forget that, your patients are human and you are human too. And so that's one of the beautiful things about being a pharmacist, is that we can step into the questions that they have. One of their biggest concerns is, oh, I'm going to become addicted to this medication. I don't want to become addicted to anything. That's actually one of the biggest issues. But, I just kind of walk through, I'll walk with them through the mechanism of action. How does it work? When should you start to expect to feel different? And so just kind of bringing it down to their level, making it simple, finding that human connection, and just kind of sharing your own experiences if you have any, or if you've learned about anything else. Mental health is super important, especially right now. It's just off the charts right now. So, and also don't forget to take care of yourself. As healthcare professionals, we can easily burn out. So just a few tidbits that I wanted to share and just quickly jump in. Another question that I have here, this is for all panelists. So this is from Miss Medina. Hello, I'm a recent grad 2020, and I am very eager to start my career in pharmacy. My goal as a pharmacist is to advocate for our profession, make a big impact in the Hispanic community, and inspire Hispanics in getting a career in pharmacy. I am a bit lost on how to accomplish this goal. What would be some words of advice you could give a new grad that is not sure how to begin this new path? Anyone would like to answer?
I would probably say just one thing you can do is attend conferences of organizations that you might be interested in. A lot of times just going to those conventions, intermingling and, rubbing elbows with their membership. And, you can tell whether or not it's an organization that you can fall in love with and really want to become a part of and maybe even become leadership in. But you kind of have to attend, conferences and, you can attend without any commitment. You can attend and just visit their membership, what they're about, what their mission is, and what, speaks to your heart and your profession and what fits for you. But attending even, local, regional, even national if you want. But you will find, an organization that does speak to you, and then you become more involved. You talk to the leadership among that organization and you find ways and you ask, and there's ways to volunteer, and they will normally be very receptive of someone who wants to be involved.
Great.
That's a very good point. I like to say that networking is very, very important. And as many of fourth year students during their rotation, they get the experience to the various types of opportunity. And so as you go through your rotations, you find your niche. And after you graduate, of course, you might not find your niche as you graduate, but find a job. And as you're networking with everybody by going to conferences and your local association, the time will come about where you will make that jump and find something that'll make you happy. And that's going to be your career for as long as you want to work.
Great. Thank you, Dr. Jimenez. Let's see here. Okay. So here's a comment question. This is from Ms. McKay. I am so inspired to see so many pharmacists centered on improving the health of Latinx communities. As a pharmacy student, I have noticed a lack of minority pharmacists in the workforce. What advice do you have for connecting with other minority pharmacists? I'm thinking we need mentors, but any other thoughts? I think we all agree we need more mentors.
Yeah.
So for those, oh, go ahead.
No, mentorship. I think there's a common theme about just building relationships. So whether building relationships with your patients to inspire them, building relationships with your communities to promote wellness and population health, or to essentially find your own sense of purpose, or to inspire others. It all goes back to human connection and really relating and building, those relationships. We can't we have all these big visions and big ideas, but without people, it's hard to actually make it happen. And so I think, remembering that it takes a village, it takes a team to really accomplish big things. And so I think, investing in the networking, investing in building relationships is definitely key.
All right. So next question here. What could be done to encourage current Hispanic pharmacy students to pursue residency programs?
I think one is to engage them early on in their education. Outreach is one of them, one of the good ways to get students all excited about care, especially if you're from a Hispanic background and you're working with the Hispanic community. It's even going to be more encouraging to be, out there either providing patient education, vaccinations, getting them early on in leadership. I've always found that to be a very strong motivator to pursue residency. One once they're able to lead an organization, get other students, pharmacy students involved in the outreach or whatever the main goal of the organization is, that also builds character. And I think they need that when they're applying to feel confident about themselves. And of course, a strong foundation in pharmacy practice and also in therapeutics is also key, which means that, make sure that they have good mentors, good preceptors, that they can actually view as role models. When they graduate or prior to graduating, just that confidence level has to be high. And even the ones that are still undecided, sometimes it's just a matter of sitting down with them and asking them, okay, so why do you want to apply for residency? Where do you see yourself? Kind of assessing what their strengths are and kind of just being that force behind them that's pushing them, even writing them a letter. I think often it's hard for them to, they come in the office and they're like, kind of saying, oh, how you doing, everything, it's your research. And all of a sudden, like, I know what they want, they want to ask for a letter. And so I'm like, yeah, I'll write you a letter. I think often we are so busy and we often just want to write maybe 1 or 2 letters because it's so hard to, but I find myself writing lots of letters because I can't say no to a student sometimes. I'll feel bad that for me, for my own, like, because I was trying to like maintain the number low, that maybe for some reason they wouldn't get into residency. So I always end up writing a lot of letters every year. And so I think you're right. Mentorship is a key. And
I'd like to add something. Sometimes you have your Hispanic student that lacks the confidence that they would be accepted in a residency program because they look at their classmates and they say, wow, 70% of my fellow classmates their GPA is just off the charts. And you might be a C or a B and you're barely passing, that you feel that you just don't have the tools to get to that next step. And I see that with some of our students that, you try to encourage them and they say, well, I don't think that I would get accepted. So, there's got to be mechanisms to stimulate and say, hey, you can do it. Just apply. It is hard work. And so, I wish the best for all Hispanic students that are applying for residency, and that hopefully we'll get more and more as the years go by.
Thank you, Dr. Jimenez, and thank you to our panelists. So for the sake of time, at 6:30, I'm going to speed through these questions. If I could just have one panelist answer the question so that we can get through all of the questions. They're great questions. So this one's more of a comment. I definitely agree. I am first-generation student, and the path to get where I am now wasn't easy. And this is from Ms. Medina, thank you. But having those mentors that guide you and teach you about scholarship and all the help that is out there was definitely key so that I could reach my goal. Thank you for those kind words. So thank you to all of our panelists. And this next question, so for any of the panelists, so if we could just go with one. Going back to what Dr. Jimenez said, what do you think may be causing Latino students to drop out of science and healthcare? Why are we so underrepresented in STEM, and how can NHPA help address this issue?
do you mind repeating the question one more time so we can get?
The question is, why are Hispanics so underrepresented in STEM, and how can NHPA help address this issue?
Well, I think that I guess it starts early on in high school, perhaps. I work with some kids that are like, I never liked science, and and then you get them to work in the lab and get them to learn about science and research, and then they realize that, wow, they just discover a passion. they never had. So we've been working with undergrads who didn't have any exposure to science, and we have a cohort of 80 students. They go through my lab, and when they come out of there, about 70% of them thought themselves as scientists before coming in there. And then about 85% of them said that their family saw them as scientists now. So it's just, I think the reason that most students don't like STEM or they don't perform well in STEM is because they're not exposed to, I believe, science experiences. And this is where camps or summer research or internships would come in handy. And I think this is where maybe our organization, like you mentioned, Dr. Rivas mentioned, could really help with putting together a list of different internship positions during the summer for undergraduates or even high school. Like, I mean, I guess for undergrads, we're not going that. But yeah, there's a lot of opportunities out there, and facilitated with the mentorship aspect of this program as well, organization, then I think it can be possible. You know.
Thank you, Dr. Verkovsky. I have 3 more questions, and then we're going to wrap it up because some of us may be starting to get hungry. So just hold on tight. So this is Jose Daniel Rangel Garcia, pharmacy student at LECOMP1. I have read articles, hear pharmacists and other pharmacy students that the field of pharmacy is shrinking every year. Salaries are going down. What are your thoughts? What would you advise students that are getting in debt to go to pharmacy school during this forecast in other professions? I mean, the field of pharmacy, in the field of pharmacy. So basically, what are your thoughts on salaries going down? Would you still advise your mentees to go into the field of pharmacy? What are your thoughts? And if we could just have one panelist.
First of all, I think the profession is being flooded. I think we're having a lot of graduates coming out, and that is due a lot in part to several colleges of pharmacy being opened up. You know, at first I was encouraged to see some open up, and it was neat to, you know, to see 1 or 2 of these colleges open up from great universities. But more and more, it almost seems like everywhere is just opening up a college of pharmacy. And if they're an established college of pharmacy, they're opening up a new location or a new campus in order to increase their student numbers. So I think first and foremost, I think, you know, state-wise, and I think it needs to be done on a state level. I believe those colleges of pharmacy do have to get approval. And so I do think that, you know, advocating and going to our state representatives, showing that, you know, at this point, I don't think that we necessarily need to open up any more colleges of pharmacy. As far as trying to maintain salaries, it's even more important to, you know, make sure that you offer value and that you know, are great and come from a great education and can offer value to any organization.
Thank you, Dr. Pula. The next question I have here is, let's see here, which organization, this is from Ms. Bueno. Which organizations were you involved in pharmacy school, and how have they benefited your professional growth? If we could just have one panelist answer this question.
I guess I'll do it. So which organizations was I involved in during pharmacy school? Mm-hmm. You know, I think I tried almost everything. ASHP, you know, the national, the state, and the local, essentially American Society of Health System Pharmacists. You know, I'm still a member today, attending the conferences and networking. You know, how it benefited me as a professional, you know, I echo a lot of mentorship is important, and sharing your own story to those that are around you, because you don't know who you're going to inspire. You know, I was surrounded by just, you know, great people from high school to pointing me to pharmacy, to my own, you know, pharmacy residency, you know, student coordinator when I was down in from University of the Pacific. You know, I didn't know what residency was until they introduced it to me. I was like, oh, that is an option for me, like what Dr. Jimenez was mentioning, and that, you know, bringing awareness. And so I believe attending these conferences, being a member of these organizations opens up doors and opens up your eyes of, hey, I could do that. I don't have to just be what is in front of me with, what's, mainstream, but I could be a pharmacist that is in a hospital or doing clinics or doing these other things. So I think sharing your stories, hearing other people and going to these events and being a member definitely helped me open up my own doors.
Thank you, Dr. Gonzalez. Another question I have here is, how does one become a mentor with your organization, and what qualifications do you look for to become a mentor? So just in general, being a licensed pharmacist in your state, and in terms of what qualifications and how does one become a mentor, what we're going to do is that we'll go ahead, it's in our newsletter, but what we'll also do is send out an email to everyone who participated today with further information. We do have a workbook. We do have some suggestions as to how to go about in terms of mentorship with our students. So please stay tuned and we'll make sure that we send out that email. And let's see here. All right. This will be the last one. And then thank you all panelists. So this is for male panelists. I worked in construction before. I saw most of my coworkers were Latino and stubborn in seeking medical help, but they have a major issue or broken bones. How can you break through the macho culture, because those men are usually the primary income for their big families. Their children have to go to work at an early age and don't have all of the economic support to go to college. And just one of our male pharmacists.
I'll answer that. Sometimes it's the shock value that finally breaks that machismo. If you tell a patient that has diabetes that if you don't take care of yourself, what can happen is we might have to amputate. And once you mention amputate, you scare the daylights out of them, and then they'll go ahead and conform to medication therapy. Previously, I owned a pharmacy for 28 years prior to coming to Western. And so my clientele were all Spanish speaking. So a lot of times their wives would bring their husbands in or their sons into my pharmacy and talk some sense to them. So I felt that the shock value worked pretty well. And so even with blood pressure, I said, if you continue, eating the way you're eating, you can stroke out or have a heart attack. No me digas eso. And I go, yeah, la verdad. And so, and then the wife would say, sí, escucha que está diciendo Dr. Jimenez. And so I think that was my mechanism of addressing that question. So hopefully you take it to heart.
Thank you, Dr. Jimenez. And so that will conclude our questions for today. I do want to hand it over to Dr. Diaz. He's one of our board members here at NHPA. We super value all of his input. He has been a rock. So Dr. Diaz, any thoughts that you'd like to share with us? And I think you're still mute. We can't hear you.
Yeah, I know. First of all, I'd like to thank you all for participating. Dr. Rios and I from the National Hispanic Health Foundation have worked hard to make sure that this organization came into being. And I want to mention in terms of financing that the National Hispanic Health Foundation does have scholarships, and we do offer scholarships to pharmacy students, both on the East Coast and the West Coast. And also, I'd like to just mention briefly that to that student or that person that was worried about the salaries dropping and too many pharmacists, there's no way that there's too many Hispanic pharmacists, no way there's too many Spanish-speaking pharmacists, and there won't be for a long time. So you got plenty of room, and there are going to be plenty of large organizations like Walmart and CVS that want to hire Spanish-speaking pharmacists. So you're not going to have a problem there. Of course, as Dr. Jimenez says, you should be good at what you do. And assuming that you're good at what you do and you speak Spanish, you are not going to have a problem getting a job and keeping it and probably making a pretty decent salary. And then lastly, although this is this is the pitch for an organization that is not ours in particular, but students that don't have time to mentor them or something, you can always refer them to Mi Mentor, which is as it sounds, a mentoring platform where students and faculty members can connect regarding all the health professions. And it's not unusual to see a pre-pharmacy student reaching out there asking about pharmacy schools and that. So that's another place that all of us can participate in that venue as well. And so we're looking forward to continuing the work with the National Hispanic Pharmacists Association, and we're really excited about the students that are becoming involved, and I think you're all providing great leadership for those students, great mentorship, and again, we want to congratulate you for participating in this and helping this organization grow.
Thank you, Dr. Diaz. And I want to give a heartfelt thank you to Dr. Rios and Dr. Diaz. They are shepherding us as we become a more solidified national pharmacy organization. So we would not be here without them. So big thank you to you both. Your support, it's unmeasurable. So thank you very much. And I want to, just say that for all of our students out there, stay tuned for September 30th, save the date, make sure that you attend and continue to come back to these webinar sessions. Our program committee is working very hard to put together a program that's going to benefit you and that's specifically tailored to your needs. So we have some experience with that, and we hope that you enjoy the program. In terms of mentors, we need a lot of mentors. So please, let's keep paying it forward. We need to train the next generation of pharmacists. And I'm seeing a lot of great feedback from all of our participants. So thank you everyone for joining. And also don't forget about our next session that is going to be on October 8th. It's going to be at the same time, October 8th, for the Southeast, Northeast, and Midwest. Also, we want to make sure that we are also supporting our members out there. So thank you everyone. Have a great evening, and stay in touch and connect with all of us on LinkedIn. Send us message, send us questions. Thank you.
Thank you to all the panelists.